So officially welcome again everyone to be on this Zoom meeting. Tonight we are actually going to be having Dr. Mark DiPasquale again as second part of the presentation of Your Health is Your Wealth, where Mark is going to be sharing more about the specifics of the products, the benefits, and how they are, amazing in terms of health, helping us to prevent and to treat actively. Just to recap on the first session last time when we did the Your Health is Your Wealth session, Dr. Mark actually shared about how to harness the power of nutrition, the different isotonic advantages, the quality of food, the national, the nutrition survey, and the industry of the supplementation, and obviously the quality of food. One thing that you may or may not know is that Dr. Mark is an amazing athlete as well. And he has just come back on the weekend to this 3 Peaks challenges. So Mark, maybe you can tell us about it. It's just an amazing bicycle adventure.
Yeah, absolutely. It was one of the it was absolutely amazing. I really can't put words to it. It was very tough. It was very tough. It was long and grueling. And if anyone out there really wants to challenge themselves, that's probably a good way of doing it. I love pushing my body to the limit and seeing what the limits are.
How long did it take you to do the ride of the 3 Peaks?
11 hours and 18 minutes.
Oh my goodness, 11 hours and 18 minutes. You know, most of you actually that were on the last call, you would have remembered Dr. Mark shared with us about, the health planning, with the -5 to +5. +5 being optimally healthy, -5 being you're, having issues, a lot of issues with your health. And I can, safely say that Dr. Mark definitely is a classic example of a +5, very healthy health professional. So I salute you to be able to do.
Always aspiring to that.
Yeah, you are +5, and I also aspire to be fit like you. So thank you. All right. So without further ado, I'll just pass the time to you, Dr. Mark, and so that you can share with us about today's topic.
Thank you, Kitty. Thank you for that introduction, and thank you also for the summary of the last presentation. I'm just trying to find out how to maximize my screen to then allow everyone to see it. Is that?
You need to go to the share button, which was below. Yes, here it is.
Got it.
Okay,
great.
Yeah,
okay, good. So we're ready to go.
Yeah, that's maximized already. Thank you.
Yeah. So that's really good. So last presentation we actually used the chat feature just to give answers to a lot of the questions. I think one of the questions which really wanted to be answered, which most people get challenged with, I get challenged with all the time in practice as well. So I don't think you're any different. And that's the question about whether I should supplement or not. Like, are supplements valuable or are they not? A lot of people just say they get it out. Oh, I'll just get it out of my food, or they might have a cold, or their immune system might be working extra hard, and you recommend vitamin C to them, and they say, oh, I'll just eat some oranges. Everybody gets that. So don't think you're alone when you hear those sorts of comments from work colleagues, friends, family, the community. It's quite normal. It's just a lead into more information. So tonight, if you are on tonight's presentation, I've got huge treats for you, because what I'm doing is this is what I actually use in practice, and basically it goes through preventative care plans and also active care plans in certain conditions as well. So if you can just follow along, there's a lot of information. If you just follow along, you'll understand how exactly everything around the isotonic range is constructed and why it's constructed that way. All right, so I'll just get straight into it. So the overall presentation is Your Health is Your Wealth, and we did talk about how our health is very valuable to us, and probably the most valuable thing to us. Let me go to the next slide. Okay, so the first thing I want to speak about tonight, I want to hit right off with digestive enzymes. Digestive enzymes for me have been the sleeping giant as far as I'm concerned. We always speak about, OPCs, multivitamin, the importance of B vitamins, etc. But digestive enzymes are so important. They're very underestimated. Now, the way that they work, and if you understand how they work, it'd be very interesting for you. There's actually 5 enzymes in this mixture. The amylase is the first one, which this digests carbohydrates. Now, mind you, the reason for digestive enzymes to start with is that in a Western diet, we have a lot of gluten. We have a lot of, gluten is a derivative of wheat. We have a lot of dairy. We have a lot of things that our body has to digest. That I call them very heavy. I call them big nutrients, and I call them very heavy nutrients. So if we don't have enough digestive enzymes, it can be very difficult to actually digest them to start with. So the second one is proteases, and these are enzymes that break peptide bonds between amino acids in proteins. So they help us actually digest proteins. So the first one helps us digest carbohydrates. The second helps us digest proteins. Number 3, we have lipase, which is responsible for breaking down fats. So that's very important in a westernized diet. Number 4, we have cellulase, which hydrolyzes cellulose, which is the principal constituent of the cell wall of plants. So to get the good nutrients out of the cells of plants, you actually got to break into the cells themselves. So we don't have enough cellulase, you can't actually break down those fibers well. And also to lactase, which is a sugar-splitting enzyme that hydrolyzes lactose. So, lactose is the sugars in milk. So when we look at a Western diet where, many times I get patients who come to me and they've seen dietitians, they've seen diet specialists, they've spoken to their doctor, and the recommendation is to, stop gluten, limit dairy. These basic recommendations over and over again happen time and time again. And the reason why their body can't digest those in the first place is because they don't have enough digestive enzymes. Now, it doesn't mean that you should be eating them in the first place. So don't get me wrong. Okay, we shouldn't really have a diet high in, carbohydrates and gluten and dairy to start with. But this is very good because when you want to transition somebody into a more of a preventative plan, or you want to show them progressively how to eat better and how to manage their life and their lifestyle better, sometimes you can't just, they can't flip a coin. They can't just go the other side of the coin straight away. They have to be eased into it. And to be able to use digestive enzymes is very, very valuable to allow them to be eating particularly the same diet that they've been eating, but then help them digest that. And then as they can see that they are feeling a little bit better and they can start eliminating some things which aren't useful for them, that's how you get the results. So it's always in health, it's always one step at a time. It's never everything in one day. And I think that's one of the key things which I want to actually just express throughout tonight's whole presentation, because we will be talking about prevention. And then what we'll also be talking about is active management when we actually do have problems. And it's important to understand where someone is and what their actual motivations are. So with regards to digestive enzymes, I want to just go straight into how we use it for preventative care of gut health. Once again, we have preventative care and we have active care. So if we want to use it for preventative care of gut health, we take 1 dose a day taken with food or directly after. Now, preferably with the largest meal of the day. Now, this is one of the isotonics that we do take with food. The other ones we take without food, we take on an empty stomach because we want a full absorption. This one we take with food because we want all those enzymes to be mixing with the food and breaking down the food and actually, so you can actually digest it. Now, generally, food comes with its own enzymes, and that's what allows foods to spoil, and that's what makes them go off, basically. It's the enzymes within them that break down the cells. Now, cooking food, which generally our Western diets are full of, cooked food, cooking foods actually kills off these enzymes. So that's why cooking food actually preserves it. So, because when you cook food, you actually kill the enzymes. Once you kill the enzymes, well, then the food doesn't spoil, or it spoils, or it takes a lot longer to spoil. And then to spoil after that, you need bacteria or you need other sort of pathogens to take over from there. So it's very important to understand how important enzymes are in the digestive system. I think it's very, very underrated. Now, for active treatment of poor gut health, let's say, for example, now we have significant gut health problems, whether it be bloating, constipation, diarrhea, bad breath, all these types of gut health issues, which are the symptoms of having poor gut health. We actually want to use also 1 dose a day taken with food directly after, taken with food or directly after, preferably with the largest meal of the day. So the same. So exactly the same with preventative to active. So this is one where you would think that with active treatment of something you'd want to be taking more, not necessary. You only need so many enzymes to do the job, and only 1 dose a day is okay, it's enough. Now, another thing I'd like to say here is that if we do take, and this is an important note, if we do take digestive enzymes or enzymes on an empty stomach, there's research that actually says that the enzymes actually get in or goes into our bloodstream, where it actually prevents cross-linkages of proteins and sugars, and that can actually help us with the aging process, the elasticity in our skin, cardiovascular health, etc. So enzymes are very, very, very important. I can't overemphasize that. So I hope this has brought you some new information about digestive enzymes that you've never really heard before, and you probably have a look at it and probably recommend it to some people around you who are having gut health issues. Another thing to think about as well is our gut health is one of the most important things that we need to be keeping healthy. There was a research paper that I was reading last week, and it stated that the number of neurons in the human gut is second behind the number of neurons in the brain. So we have our brain, which is our most powerful computer, and then we have our digestive tract or our gut, which is the second most important part of our whole body. And when you think about it, the role that it has to take in protecting us from the environment, bugs, germs, everything around us, protecting us, controlling our immunity is hugely, hugely important. So yeah, I love the digestive enzymes. I love what enzymes can actually do for our health. So that's digestive enzymes for us. Now we move into ultimate aloe. So ultimate aloe is, look, it's absolutely amazing because we know that aloe vera has amazing healing properties. Now, we probably don't understand, well, you probably don't understand why the healing properties are that way. And that's because the aloe molecules within it are actually hydrophilic. So now that's opposite to hydrophobic. Hydrophobic is actually repelling of. So if you are an arachnophobe, it means you don't like spiders or you're repelled from spiders. You're scared of them. If you're an arachnophilic, you'd actually like spiders. So that's just a little way I remember that of the how hydrophilic or hydrophobic works is that anything that is hydrophilic will actually attract water. And with an aloe plant, when you actually rub the aloe leaf on a cut, it actually brings the water within the body to the surface and allows the cut to heal from the inside out. In doing that, what actually happens, you get faster healing, because other than that, what has to happen is it dries from the outside in, and then it's a different healing process altogether. So, and what it does in the digestive system is when we drink aloe, what it does is actually draws water out of the lining of the digestive tract into the food. So not only does it help with the healing of the lining, but there's numerous times where I've recommended this for people with constipation because they just haven't had the right balance of water in their digestive system. And very often after they have some aloe juice, what happens is they go to the toilet because there is that hydrophilic effect of more water in the digestive system. Now, point 2, which is interesting as well, is it contains over 200 nutrients, enzymes, vitamins, and minerals, including 13 of the 17 essential minerals needed for good nutrition. Now, the aloe has been removed. So it's packed with nutrients, minerals, and vitamins. The aloin is the important thing that has to be removed because it's actually toxic. So that can't actually be, you can't actually drink that. So definitely don't go out there and eat aloe vera plant because it will actually make you pretty sick. If you have enough of it, the aloe has to be taken out of it. Point 3 is it contains the International Aloe Science Council seal that certifies the aloe content and purity. So this is pretty important because there are other aloe drinks out there. They don't have to be certified. So, you know, this just makes sure that the contents are what they say they are, that if we're going to be using it as a health or a wellness product, that it's going to do what it says it's going to do, and we can be confident in that. Now, with regards to using it for preventative care of gut health, we use 30 mils taken any time of the day. So this can be taken basically any time of the day. You don't have to worry about whether you're having it on an empty stomach. You don't have to worry about whether you're having it with food. It's just got to get in there. So taken any time of the day. Now, for active treatment of poor gut health, we want to increase that a little bit more. So 60 mils is what I recommend. So 60 mils taken any time of the day is good. Just to give you an idea, 30 mils is around about the caps of the bottle itself. So 60 mils is just a small cupful. Okay. Now, also what I'm going to be doing is I'm actually going to be going through a structured plan of preventative administering of these, and also an active treatment form too. So at the end we'll be going through those. So I just want to go through the main points of all these at the moment. The next we have isotonix OPC3. If you didn't know, the main ingredient in that which we want is the pine bark extract, which is the pycnogenol. There are many research papers. You've got to really have a look at some of them. There's just so many. The supreme antioxidant capacity of pycnogenol is extraordinary. Now, what it does is increases vascular blood flow due to the action of nitric oxide receptors. So what that means is in the walls of all our cells, so imagine our blood vessels are like hoses traveling everywhere. In the walls of these hoses or our blood vessels, we have nitric oxide cell walls, and we have nitric oxide receptors on these cells. Now, when a nitric oxide molecule attaches to one of these cells or the cell walls, what happens is the muscle in the cell wall actually dilates, or it actually relaxes off and dilates the actual blood vessel. So if we had nitric oxide in our system, we have blood vessel dilation. When someone is having a heart attack or they're having angina problems, which is the pain on the left side of the shoulder and the chin and everything like that, a lot of the medications that are given contain nitric oxide to dilate the blood vessels, so the blood flow can actually help and continue on. Number 3 is the anti-inflammatory capacity of pycnogenol, so hugely researched, and it really works. It's awesome stuff. Now, for preventative care for general health, so moving into general health now, of OPC3, we will take 1 dose a day taken on an empty stomach. Okay, so an empty stomach because we want full absorption. Now, my last presentation went through how full absorption can take place and the comparison between tablets and capsules and the isotonic formulation. So if we want to get upwards of 95% of whatever we're putting into the body, well, then isotonic is the way to do it. Now, for active treatment of poor circulatory or heart health, or also immune system health, we take 2 doses taken daily on an empty stomach. Okay, so we want to double that up. Okay. All right, now let's move into multivitamin. So multivitamin is absolutely fantastic. Firstly, I'd like to say that there's no substitute for a well-balanced diet. But industrialization and industrialized diet has made it difficult, if not impossible, to achieve. So there's, my last presentation did go into the food production and growth procedures, which do take nutrients out of our food. Look, if you're speaking to a person who just says, look, all our food is highly nutritious and I get all my nutrients out of my food, and they're stuck on that, so be it, don't worry about it. But you know, most people are open to the understanding that, yes, food wasn't grown the way that it was many, many years ago. So supplementation is very valuable. Isotonix multivitamin contains 100% or more of the daily value of 21 essential vitamins and minerals. Okay, so not all of them, obviously, that would be impossible. The 21s of the very important ones. And it is in isotonic form, which is very, very valuable to us. Now, for preventative care, for general health, we take 1 dose a day, taken on an empty stomach. And I haven't really written in there as an active treatment, because you don't necessarily actively treat health or ill health. It's generally a system. So I have an active treatment at the end of the presentation of how we would use multivitamin in active treatment of that. Isotonix Advanced B Complex now. So vitamins B1, B2, B3 and biotin participate in different aspects of energy production. You may have heard that the B vitamins are very important in energy, and that the B complex, the advanced B complex is good when you're feeling a little bit tired. Well, these are the reasons why. So vitamins B1, B2 and B3 and biotin participate in different aspects of energy production. So that's one aspect of it. Now also deficiencies in folic acid, vitamin B12, vitamin B6 or biotin, they also result in fatigue. So that's the other side of the coin. So it's all very good to have something to have energy, but the thing that's happening is we don't have these vitamins and minerals, so that's why we're actually fatigued in the first place. So that needs to be understood. And vitamin B12 and folic acid facilitate steps required for cell division. And that's very important too, because that takes a lot of energy out of our body. To heal, we need to remake cells. It's a very complex process, and this helps very, very well. Now, vitamin B5 is involved in the Krebs cycle of energy production. So if you ever did high school chemistry or even university chemistry, the Krebs cycle for energy production is needed to make the neurotransmitter acetylcholine, which is important in the nervous system. And B5 is also essential in producing, transporting and releasing energy from fats. And it also promotes cardiovascular health. So it's very, very important compound in there. And vitamin B6 is essential for amino acid metabolism. So that's very important for us as well. So B complex is just that, a complex of B vitamins that help on many different aspects of health. Now, with regards to preventative care for general health, 1 dose a day taken on an empty stomach is perfect. That's what we would like. And also, once again, there is no active treatment that we would generally use for advanced B complex, unless it was, if we're talking about persistent, let's say, for example, we're talking about persistent tiredness or fatigue, such as chronic fatigue, etc. You wouldn't just tackle that with B complex vitamins. You actually tackle that with a more aggressive general health active treatment of, okay, which will come at the end. Okay, so now isotonix calcium plus. So number 1, calcium levels must be maintained in the bloodstream our entire life, or the body will get it from the skeletal system, which is the bones. So I think most people know that you know, calcium comes from the bones, and that's what we've been brought up with, that you need to be eating, you know, your dairy and everything like that to get enough calcium when you're young, so that you build up a strong skeletal system. Number 2 is calcium from dairy products are good, but the body cannot process dairy well, which leads to digestive problems or inflammatory digestive problems. So, you know, the problem with dairy products themselves is, you know, we have been brought up on that, yeah, you should be drinking your milk, having your cheeses, etc., to get all your calcium that you need for your bones. But the problem with that is the inflammation that the dairy actually creates in our digestive system is even worse. So it's not the best way to actually get it. There are far better forms of calcium, nuts, and all sorts of things. A supplement is a good way to do it. So just wanted to say that as well. Now, one of the benefits that the isotonic delivery system gives with the calcium plus, which it doesn't give with many of the others or any of the others, is that because they're actually mixing it there and there with the appropriate amount of water, calcium compounds being so unstable, we can actually create some that are very bioavailable to the body, that the body actually likes more than just your general calcium carbonate. So if you pick up a bottle of calcium tablets from the chemist or from the supermarket, you will see that pretty much 100% of the time, the calcium will be a compound of calcium carbonate because it is the most stable. It can be compounded into a tablet. It lasts forever, and it's actually the least absorbable for the body. So what we're able to do with the isotonic delivery system is actually mix calcium carbonate with water, and also we can actually allow the compounds to break apart and then mix to other forms of calcium, such as calcium citrate, calcium lactate, calcium phosphate, and calcium sulfate. Now, these are far, far more, how do I say it? The body absorbs these and uses these far, far quicker than calcium carbonate. It likes it a lot more. So the isotonix calcium plus is absolutely amazing technology for being able to get these different types of calcium compounds within our system. That's why it works so well. Also, vitamin D3, which is in Calcium Plus, facilitates the calcium absorption, and they actively work together in bone growth. So vitamin D3 is essential for the uptake and the use of calcium in the system. So for preventative care for general health, Calcium Plus would be taken once a day, so 1 dose a day taken on an empty stomach. Now, something to note as well is it's very good for sound sleeping. So 1 dose can also be taken before bedtime. And the reason why it aids with sleep is because when we're sleeping, and if the calcium levels in our blood dip too low, the body will start working on breaking down calcium from our bones to replenish the blood supply of it. And what it does is the body actually gets into restlessness, gets into restless sleep. So if there is calcium in the bloodstream before we go to sleep, well, then the body won't have to work to actually break it down out of the bones. It won't be doing any extra work when we're actually sleeping. So that's a little bit of a trick, or a little bit of a note to understand that if you've got someone who's not sleeping very well, calcium before they go to bed can help them a lot. Now we move on to isotonic vitamin C. Now, isotonic vitamin C, you see that it's new there. It's new because if you haven't seen it, the compound now is at a fantastic new lower price. So it's absolutely amazing that we can actually allow the market determine how much things cost and how it all works. So it's absolutely great. The first point I'd like to make with vitamin C is it's very, very important. It's one of the most important vitamins in the immune system. So as soon as vitamin C drops down to low levels, our immune system just does not work, doesn't function properly. And there are many reasons for that. So it's just an understanding, or we do need to understand, that vitamin C is hugely, hugely important. It's great it's very important for the immune system. It's very important for the reproductive system. But there's pretty much no system that can't go without vitamin C within the system. Now, the beta-carotene, which is a vitamin A precursor, facilitates the active uptake of vitamin C in the body. So this is important, that it's actually part of the compound. And point 3 is, in isotonic form, 1 dose of this delivers 1,250% of the recommended daily intake. So, safely, this is how important vitamin C is. And generally, in Western society, this is how deficient we are in vitamin C. We need to be taking more and more vitamin C. We can't eat enough of it, and it's so important in our general health. We need to be taking a lot of it. I recommend a lot of this in practice. Now, for preventative care for general health, 1 dose a day taken on an empty stomach is good. Okay, it's a good preventative measure. Now, for active treatment during immune system fight, so if the immune system is going through a fight with a bacteria or a virus or something like that, 5 doses taken a day on an empty stomach. Now, this would be continued until the bowel signs indicate saturation, which means that the bowel tells us that there's enough vitamin C in the system, and now the bowel is getting rid of it. So what actually happens is the bowel turns to water pretty much when we're going to the toilet. Now, it takes different amounts of time to get to that point. I've been keeping a track of how long it takes many people to get to that point. Most people will take anywhere from 14 to 21 days to get to saturation, even taking 5 doses a day. So you can't just take this for a day or two and think, oh, I've got heaps of vitamin C in my system, because you can be very depleted of it, and it takes a lot, especially if the immune system is working hard. So let's move to isotonic isochrome. So isochrome picolinate creates normal glucose metabolism, preventing blood sugar level spikes. So the chromium within this compound allows our blood sugar levels not to spike. Now, this is one of the major components of diabetes, which you don't know. This is why this is a very good product for those with diabetic problems. It also allows natural transport of glucose from the bloodstream into the cells, which is very important that they're not actually delivered too quickly. And the chromium also helps to keep muscle and increase the metabolic rate. In the literature, you'll read that this is a good weight loss help and a supplement. The reason why it is because what actually happens is when one generally loses weight because they'll be dieting or starving themselves, mostly what happens is they lose muscle content. Now, chromium actually preserves muscle content in the body. So when someone is going through that process, they actually retain their muscle. So therefore, they don't have to deal with it later on, because when they start eating again, they've lost the muscle, they then start putting weight back on. So now they've got two problems. They've now got less muscle in the body to burn fuel, and then they've also got extra weight. So it's even harder in the future. Now, this is the reason why isochrome has been used so much in the, or chromium in general has been used so much in the weight loss industry for those processes. Now, coenzyme Q10 is also in this compound, and it's involved in electron transport and energy production in mitochondria. So the mitochondria are the little engine rooms within our cells. That's the energy production centers of the cell. You can think of it like a little generator within a cell, where about 95% of the total energy required by the human body is generated. In the cellular system, it functions to generate energy from oxygen in the form of ATP for bodily processes. So if you picture the room you're sitting in now like one cell within the body, and the body has trillions and trillions of cells, within that room you have a little generator in there actually creating energy. Okay, that's what it does. It's a little mitochondria is a little engine creating energy, and it needs fuel. Okay, so coenzyme Q10 actually helps with that. Now, also coenzyme Q10 acts as a free radical scavenger and an antioxidant in the mitochondria and cell membranes, protecting them against peroxidation of lipid membranes. So the mitochondria, once again, which is the energy producing center within the cells, the little generators, the coenzyme Q10 helps them by being free radical scavengers and also antioxidant within those, and actually protects the lipid membranes of those cells. And coenzyme Q10 is shown to be especially beneficial in patients with heart failure and patients on cholesterol-lowering medications. And chromium picolinate helps to keep muscle and increase the metabolic rate. And these are a couple of reasons why. So awesome product. So for preventative care, for general health, it's recommended 1 dose a day taken on an empty stomach. So isochrome is taken on an empty stomach like the other isotonics. Also for active treatment of diabetes now, so we're talking about active treatment of diabetes, we would be recommending 1 dose a day taken on an empty stomach.
Hi.
Hey, Chris. Good to see you.
Sorry, everyone.
Checking my notes.
The puppy.
So So for active treatment now, there can be practitioners who will recommend higher dosages of isochrome, but as we do get into the active treatment, I will be showing you how this will be working in conjunction with others that will help it, maximise it and boost it. Now we move on to isotonix magnesium. So magnesium is the fourth most abundant nutrient in the body. Now, whenever I tell my patients that it's the fourth most abundant, they always say, well, what are the other three? It's fascinating. I'm sure you're asking the same thing as well. So the other three are calcium, sodium, and potassium. So it's very, very important. And it's also important to know that magnesium deficiency is misdiagnosed because it does not show up in blood tests. And the reason why it doesn't show up is only 1% of the body's magnesium is stored in the blood. So when we take a blood test and we're checking for magnesium, you're not actually getting the content of magnesium in the body. Okay, so that's important to understand. And it's important to understand that because a lot of people leave their health to their blood tests. They go and see their doctor and they say if their blood tests are all fine, they think their health is fine, but it's not that way. So point 3 is it works in the relaxation cycle of the muscle spindle. So it's opposite to calcium. So the way the muscle spindles work in all muscles, I like using the heart as an example. So the heart is a muscle that contracts and beats. Now for it to actually contract and expel the blood out of it, it actually uses calcium to actually contract. And then what happens is to relax, it actually uses magnesium to then relax off the muscle spindle or the muscle to relax. So you have this cycle, calcium makes it contract and then magnesium makes it relax. Now that's all very well, but imagine how often the heart needs to beat in a day, in a week, in a month, in your lifetime. And then also have a bit of a think that your calcium stores are in your bones. So if you don't get enough in your diet, you've got your bones which can continue allowing your heart and all your muscles to contract. But magnesium can't be made in the body and it can't be very well stored. So we need to actually be eating it. So if we don't have magnesium in our body, how are these muscles going to easily relax? So that's why you get conditions where there's more contraction than relaxation. Okay, now there's a lot of science behind it, and it's not an easy theory. But why would we have excessive amounts of blood pressure and overworked hearts, etc.? It's like because there's way too much contraction going on and not enough relaxation going on. So that's just something to keep in the back of your mind. Now, with regards to preventative care for athletes, because generally magnesium is in the multivitamin compound, not to the same amount that it is in this as well. So for preventative care for athletes is what I generally recommend. We wanted to get magnesium into a general person who doesn't do much exercise or just does general exercise. We'd be recommending the multivitamin, but for athletes, we definitely need to be recommending magnesium. And that's 2 doses a day taken on an empty stomach, okay, for preventative care. Now, for active treatment of muscle cramps, so if someone is going through cramps, muscle cramps, etc., we can take 1 dose daily on an empty stomach, and that will really boost up the magnesium levels to a high level and possibly relax off those muscles that have been contracted too much. Okay, so now let's move to heart health with essential omega-3s. So the first real key to understand with regards to omega-3s is the EPA and the DHA ratio. That's important. Okay, so the EPA-DHA ratio, heart health essential omega-3s is 4.5 to 3. So 450 milligrams of EPA, 300 milligrams of DHA, or 4.5 to 3. It's important to understand this because ratios in most omega-3 supplements that I've seen aren't at that ratio, and this is a very important ratio. It's the healthy ratio that we need to be keeping. The second point, which is very important to understand, is that all the omegas within the essential omega-3s comes from small fish, being anchovies, sardines, and mackerel, where other competitive products use large fish, which are more likely to accumulate toxins. The longer a fish is left in the sea, the longer it's swimming around in the toxins, and the longer it accumulates in its organs. So having young fish which aren't around for a very long time is very beneficial because we don't have any heavy metals, etc., much less. Now also, essential omega-3 is tested for arsenic, cadmium, lead, and mercury. It's also tested for biological contamination. It's tested for pesticides. It's also PCBs, polychlorinated biphenyls, which are industrial compounds created during inferior production or extracting the omegas. It's also tested for dioxins, which are environmental pollutants. And it's also tested for benzoapyrene, which is actually hydrocarbons produced from the incomplete combustion at high temperature. So in the production process, if there's incomplete combustion at high temperatures, it produces this hydrocarbon, which is very unhealthy for us. So it's a very strict regime of how omega-3s need to be made. So look, patients tell me sometimes that they can get cheaper omega-3s at the supermarket. It's like, I tell them, take them at your own peril, because I don't know what's in them. I don't know how they're being produced. There can be some toxins in there that shouldn't be there. So if you want to take those, you take them at your own peril. But at least these, I know, are going to be tested for all these, and they're going to pass with flying colours. And that's very important too, because we want to create health. We don't want to create other problems later on. So for preventative care for heart health, we want to be taking 2 capsules a day taken with food. Okay, so with food. So the omega-3s is actually mixing with the food, going through the system, being absorbed. For active treatment of circulatory or heart health, so if one has high blood pressure, they have had a heart attack before, even cholesterol issues, circulatory issues, 2 capsules a day taken with food is the same regimen for active treatment as well. Okay, so now let's move into preventative care regime, or the preventative care regime. So a preventative care regime for, and we're going to go through the general systems now. So there, it's a background of the different products that could be used. Now let's go through how they can actually be used. So let's have a look at a preventative care regime for gut health. So step 1 may be to introduce digestive enzymes. So that is, as I mentioned before, taken with food or directly after, and that's one dose daily. Step 2 would be introducing into the gut probiotics. Probiotics are very, very important. We haven't spoken about them yet in this presentation. Probiotics are the good bacteria which basically eat away the food, break down the food for our body to be able to absorb it. Now, the good bacteria is actually killed by things like medications, antibiotics kill them off. You know, there are many, even poor diets kill them off. General health, or if gut health is not good, the good bacteria, being a living organism and flora, can't survive. So these need to be, and they should be, reseeded and retaken regularly. So these are taken before food, okay, to set in the gut a little bit before food, and 1 dose daily. Now, step 3 would be ultimate aloe, taken any time of the day, and as I've mentioned before, with a preventative care regime, would be 30 mils a day. So those 3 steps, and generally you can sort of step with levels of importance, although neither is as important as each other. But stepping from digestive enzymes, then stepping to probiotics, and stepping to ultimate aloe is a good stepping process to probably bring somebody through. Okay, so start with the digestive enzymes, go to the probiotics as well, then go to the ultimate aloe, okay, for wanting healing of the gut that has been probably damaged over time. Now let's move to a preventative care regime for general health. Now this is a bit different. Now this basically constitutes what we've spoken before about the benefits of OPC3, multivitamin, advanced B complex, and calcium plus, all taken on an empty stomach, 1 dose daily. Now this is why the daily essential kit is so important in general health, because it's the foundation of all good, well, foundation of supplementation, I suppose, for general health and preventative care regime. Now, if we were to add to that as a step 2, vitamin C, 1 dose taken on an empty stomach, and then if we were to add to that isochrome, one dose taken on an empty stomach, we get all the benefits of what I actually spoke about beforehand. This is what this preventative care regime would deliver us. Now, for preventative care, a preventative care regime for heart health, step one would be OPC3, taken on an empty stomach once again, one dose daily, and then omega-3s, taken with food, 2 capsules daily. And then if we were talking about a preventative care regime for athletes, we would have the general health regime, and then we would add magnesium. Okay, so for the general population, you wouldn't really need magnesium as an extra. If you're starting to do a lot of exercise, you're starting to really allow the engines to really work, we would want to actually add magnesium to the overall preventative care regime. So 2 doses of that taken on an empty stomach. So here's an example plan of how to manage and take a complete preventative regime. Let's say, for example, we wake up in the morning, and once we wake up, or as soon as we wake up, we take 1 dose of OPCs, multivitamin, advanced B complex, calcium plus, vitamin C, and isochrone. Okay. Now, if we were athletes and we were doing like a lot of training, we would then add magnesium to these compounds. So we wouldn't eliminate the multivitamin because it has magnesium in it. We'd actually keep the multi in there. We get the extra magnesium from that, and we actually add magnesium itself. Now, then what we would do is we would wait 30 minutes before eating anything else. So I mentioned exercise there. So it would be a good idea if we were to get up, take these, and then go for a walk or do some form of light physical exercise just to get the blood flowing. Okay. Now, step 2 would be then, once we return from our exercise, most people just can't wait to get to their first coffee of the day. It's extraordinary, isn't it? But we should be doing exercise first thing in the morning. So step 2 would be 10 minutes before breakfast. We would take our probiotics. Okay, just let that settle into the gut a little bit, or a bit of time. So probably now prepare our breakfast in that time. Then we'd be eating our breakfast, and while we're eating our breakfast, we take 2 omega-3 capsules at that time. Now, we'd be taking digestive enzymes with 1 meal of the day. Generally, for most people, it wouldn't be with breakfast because that wouldn't be the biggest meal of the day, although we still can take it with breakfast. Although I would prefer that it's taken with lunch or dinner because they're bigger meals, and preferably with the biggest meal of the day. And at any time of the day, drink 30 ml of ultimate aloe juice. Okay, so generally for myself, so digestive enzymes and aloe at lunchtime. Now, a note to understand is that for athletes, we would take a second daily dose of magnesium after exercise or at the end of the day. So if we went for a run or a cycle or a swim or something, we'd then take magnesium straight after that. Or if we weren't doing any extra exercise during that day, we'd take one right at the end of the day. And also, if we're fasting over breakfast, a lot of people do use, and it's very successful, I do myself also, is fast from dinner to lunchtime, even past that time, just to give the body a rest from digesting. You will do point number 2 and 3. So instead of 10 minutes before breakfast, take probiotics, it would be 10 minutes before lunch, take probiotics. And then with lunch, take 2 omega-3 capsules. So you can do that with lunch or dinner. Okay, that's if we're actually skipping breakfast in the fasting mode. Now let's move to active treatment. Okay, so that's for preventative treatment, as we just spoke about. Now this is active treatment. So let's talk about active treatment for gut health. So gut health has digestive enzymes taken with food or directly after, 1 dose. Probiotics taken before food. This is 2 doses, so we're upping the doses of probiotics because we have obvious digestive health issues. And then ultimate aloe taken any time of the day, 60 ml of the day, not 30 ml with a preventative care plan. This is 60 ml because this is active treatment. Now you'll notice there that I've got number 1 before all of them, whereas in the preventative I had number 1, 2, and 3, which is a stepping process. Look, once you've got gut health issues, there's no mucking about with this. You need to hit it, and you need to hit it hard. You've got to get the gut healthy. You've got to get the digestive system healthy. because it is so, so important. So really the recommendation from me is always these three, and they've got to be done, and that's it. So look, if one doesn't want to take care of it, that's fine. It's always, it's always up to their own discretion, but they shouldn't be dabbling around, I'll try this, I'll try that, because it's far too important to let the gut health go if it's already been damaged and suffering. So here's an example plan of how to actively treat poor gut health. So first, it would be 10 minutes before breakfast, we take probiotics, as we spoke about before. Then we take the digestive enzymes with 1 meal of the day, usually the largest. Then at any time during the day, we drink 60 mils of aloe, the ultimate aloe juice. And we continue this regime for 2 weeks and then reassess. We'd reassess how well the gut is actually working. We'd assess it with symptoms. We'd also be assessing it with mood. We'd be assessing it with energy levels. And then we'd be looking at how much do we actually continue this on, or whether we go to a more preventative method, or whether things are actually changed. Okay? Now, active treatment for circulatory or heart health is a bit different. So here we have OPC3. We would be taking 2 doses of this daily, and then omega-3s, we'd be taking 2 capsules daily. So we're upping the omega-3s, obviously, if we have a circulatory or we have heart health issues that we want to actively treat. An example plan on how to actively treat poor heart health is upon waking, we take 2 doses of OPC3, that's fine. So you can do it just 2 doses at the same time. You don't have to separate the doses. It all goes into the bloodstream. And then step 2 is with breakfast, take 2 omega-3 capsules. So for this, by breakfast time, it's out of the way. You don't have to worry about it for the rest of the day. And the recommendation would be to continue this regime for 3 months and then reassess. So 3 months is a fairly long time. It's 12 weeks. So this has got to be a bit more persistent with this one. Now, active treatment for immune system health. Now, a typical example of immune system health is if someone has a cold or a flu or something like that. They're just under the weather. Okay. This would be OPC, so 2 doses taken on an empty stomach, and then vitamin C taken on an empty stomach also, but this would be 5 doses. Okay, so 5 doses daily. Now, they can be taken at the same time, but it is also good to split them up. So possibly, 3 doses at breakfast and 2 doses at lunchtime, or during the middle of the day on an empty stomach. That's how important it actually is. Now, so an example of how to actively treat and support active immune system would be, so upon waking, we take 2 doses of OPC3 and 2 doses of vitamin C at that time. And on an empty stomach during the middle of the day, we take 2 more doses of vitamin C. And then on an empty stomach before dinner, we take 1 dose of vitamin C. So that's 5 doses of vitamin C for the day. We continue that regime until the body has had enough vitamin C, which means our stools go very runny. And then at that point, consult your practitioner, because then they need to find out what's the next step. Now, the reason why that is because generally a cold or a flu or being under the weather will last anywhere between 3 days to 7 days. If they're not doing too well or the immune system isn't strong enough, it can last 10 days, etc., or even a bit longer than that. Generally, then, to saturate the system with vitamin C is going to take anywhere from 2 weeks to 3 weeks. So even when they're feeling better, they need to continue this regime to instate or instill further health. So that's very important to not stop as soon as they're feeling better. Now, active treatment for diabetes is isochrome taken on an empty stomach. The benefits I've gone through before. And also OPC3 taken on an empty stomach. Now, 1 dose daily of these 2 only. That's fine. An example plan of how to actively treat diabetes is upon waking, take 1 dose of isochrome and 1 dose of OPC3. And then continue this regime for 3 months and then reassess. Now, it's okay in this situation to go and get a blood test after 3 months and recheck everything again. And don't be surprised with regards to cholesterol levels, etc., getting better and all that, because this is how these actually work. Now you add exercise to the picture as well. Is pretty much what needs to be done in human physiology to stop the diabetes process, depending on how progressed it actually is. So a reassessment would definitely be from a 3-month to a 6-month time frame blood test and seeing how well things are going. Okay, so they're the preventative and the active treatment care plans in a nutshell. Just checking the time, very close to 9. That's the end of the presentation. I'll open up to questions if anyone's got any.
Thank you, Dr. Mark. Wow, that was amazing.
All right.
Okay, who was there? Got people wanting to ask questions. If you want to just type in the group chat, we can do that. And during your presentation, Dr. Mark, I've sort of like written a few comments, just sort of like my comment and experiences as well. And first of all, I'd just like to thank you for teaching us about the concept of hydrophilic, which I've never heard of, which is attracting water in regards to the ultimate aloe. And also I was sharing that I've seen a lot of speakers who actually, when they speak a lot, they get sore throat or throat issues. When they drink the ultimate aloe, like not just a standard 30 or 60 or even more, the voice is resumed really quickly. So, so apart from gut health, it helps with sore throat as well.
Yeah, absolutely. Because it's such it just heals the damaged cells. You don't know that the cells on your lips and within the outside, so within your mouth, they actually get replaced every 2 to 3 days. That's how quick those cells actually regenerate and get replenished. So that whole system, as you know, it's very, very dynamic. So things like Ultimate Aloe can really, really help, and it's important to support them with that.
Yeah, and I also remember reading about the ultimate aloe having the whole leaf, which is 100% of the aloe leaf, and then 50% on top of it, which is the aloe powder. So it's actually 150% rather than the watered down version of a lot of those aloe juice in the market. So it's really concentrated. Yeah. And the other thing is, I remember a while back you were sharing about the importance of isotonix vitamin C, because it actually equals a lot of oranges.
Yes. Wow. Yeah, upwards of 20 plus oranges in one dose of in 500 milligrams. Like, as in one dose of vitamin C would be upwards of 18 oranges.
Yeah, that's amazing. That I so remember that was like, oh wow, mind-boggling, right? Like we have to eat 18 oranges in order to equal one isotonic dosage. Okay, and let me see. Yeah,
I'm trying to also get to the comments area as well. Just have a quick look too.
Yep.
Just bear with me while I try and get there as well.
Sure, because as you were sharing, I actually put the comment, and there were some question as well. One of the things that I remember we talked about last week as well is some people actually had issues swallowing capsules, and so without Heart Health Essential Omega-3, it's actually they're quite big, and for people who've got issue with that, I remember the product team has shared with us that we can actually cut it, like break it down by a knife or needle, and then break it into like food and eat it and drink it together, rather than having to swallow it if it is too hard.
That's correct. Yes.
Yeah.
There's also some on the chat about the probiotics. The probiotics themselves are on, as you mentioned, Kitty, in the chat, they are on global. Now, there's actually been a new formulation that has actually come out on global just recently too.
Oh yes.
One of the things with probiotics is it's advancing very quickly. So what the company is trying to do is it's trying to advance the latest with it. So because there's different ways, there's some different technologies that are happening. Okay. Like, as an example, it hasn't been too long since probiotics had to all be refrigerated. And then what happened is there's technology that came along that then it didn't have to be refrigerated. So then there's actually technology now that allows the bacteria, once you actually eat it, to actually be activated. Okay, so there's different things happening in that space. So I didn't want to sort of get into that too much with what to take, how to take it, because by all means, within another, say, 6 months, 12 months, 18 months, there's going to be new information to learn again.
Yes.
So probably a thing just to keep open, that probiotics are something that we need to take. We just need to investigate what's the latest, the greatest. The company's up with it. Let's just find it and then just take it.
Fantastic.
Yeah.
For those that are in, like, global, they just certainly we can actually go onto our global site and find out more through the website. But definitely, I agree, like what you were talking about, the importance of active treatment if people have issues with their digestive, and all that. And Jamie Chai has a question for you, Dr. Matt, that for teenage athletes under 18 years old, say 14 to 15 years old, what is the suggested dosage?
For magnesium?
Yeah.
That'd be for magnesium, I think, Jamie, would it? Same, just double dose.
Just double dose. Okay.
Yeah, double dose.
Yeah.
Yeah.
Okay, and this is my personal testimonial. Like before I started taking all of these isotonic products, particularly OPC3 and vitamin C, when I used to every year had cold and flu, even if I did flu injection. But after starting to take, the OPC3, vitamin C, and the daily essential kit, every time, even if I have had cold, I would get well within just a couple of days. Rather than in the past, I would be like sick for like sometimes week, 2 weeks,
Yeah. Well, now you know that the flu injection doesn't work.
It does not work at all. No. So that's why it's very important for all of us to understand that, if we do have cold and flu, then like Dr. Mark said, to have 2 dosages of the OPC and 5 of the vitamin C. But even for the prevention, it's very important for us to have both the OPC and the vitamin C.
Now, there's also a reason why we take OPCs with the vitamin C as well. Now, the reason why is that, so vitamin C molecule actually binds to the immune cells to activate them. And then what happens is that actually takes up the binding space.
Yes.
Okay? Now, the OPC, what that compound does is that actually competes with that site. So what it does is it actually knocks, so once a vitamin C molecule has attached to an immune cell and got it activated and it's working, it'll stay stuck there. The pycnogenol molecule will come along and knock that vitamin C compound off, molecule off, and then it'll recirculate again and activate another immune cell. So the vitamin C compound, the same compound, can be used 5 or 6 times, when if you didn't take vitamin C, it can only be used once.
Yes.
So it increases its power, basically.
Oh, okay. That makes sense.
Yeah.
And also, as you mentioned last week, I think the synergistic approach as well. Yeah, the two working together better than individually.
Correct.
Yep.
Yeah. For that reason, that's the biochemistry behind it.
Biochemistry. Okay, fantastic. And the other question is from Heidi Chang. With the diabetes treatment, if they are already on the tablets, can they also at the same time take what you were referring as the active treatment?
Yeah, you definitely should, because I would be hazard that the tablets would not be working.
No.
I don't see them. In practice, I continue to look at blood tests of my patients, and those who are just on the tablets, their levels never normalize. They never get healthy.
Yeah, Heidi, I'll just share a little bit of 2 people that I've worked with. One is my mom. My mom, even though she's very skinny, used to, still at borderline of diabetes, high sugar level. But she used to take even insulin and treatment. But to a point that it just didn't work for a while. And then she has high high blood pressure and high cholesterol. Now, I put her on OPC3 and isochrome, just exactly like what Dr. Mark was talking about. In fact, 2 OPC3 and 2 isochrome, even though she didn't have to lose weight. And she was able to have her, blood sugar level diabetes under control. So definitely, it is active treatment. And I would hesitate to say that, it's certainly obviously you have to have your doctor working alongside to let them know you're taking this isotonics, but at the same time, if they can see that there's a difference, they will be allowing the patients to slowly even wean off the treatment like my mom did.
Yeah.
And then I had quite another lady. She really had diabetes, very severe, like more so than just high sugar level. And she was my TLS client. And, she took isochrome and OPC3, and the doctor actually slowly reduced her dosage, even though she still had to put insulin level, injection and all that. So you can truly see that isochrome and OPC3 both are amazing diabetes, active treatment for sure.
Yeah.
It is.
I always ask my patients and talk to them in a way that it's like what they've been doing, is it working? Like, are they, not diabetic anymore? Are they actually healthy? It really gets them to understand. It's like, well, no, I'm not actually healthy. It's like, how long do I have to be on these medications? It's like, well, see, once one's put on medication, the understanding from the medical industry is that they're going to be on that medication for the rest of their life. That's not health. Health is not that you are on a medication for the rest of your life. Yes, I could understand if it normalizes the blood levels, and then you come off it, and then you go back on it again. But it's just, that's not the world we live in.
Exactly.
And people are just getting more and more sick.
That's right.
There's no way out.
Yeah.
So this is a definite way out.
Which reminded me that I think one of our other presentations, we talked about, the wellness revolution versus sickness industry. So, with tablets and pills and all that, is sickness industry, which is just masking the symptom. There's no active treatment like Dr. Mark talked about here. Whereas with the wellness revolution, like what we're on about here, is really to be able to have all these natural and great compounds that help us to get better. Like towards if you're 0 right now to a +1, at least towards the more positive side of the health spectrum.
Yeah.
Yeah.
That's good, Kitty.
Yep. And Colin Nixon has a question. He asked, would active treatment for diabetes be expected to help to reverse type 2 diabetes?
Yes, that's what active treatment of it is. So classification of diabetes is type 2 diabetes. Yeah.
Yes. Whereas type 1 it's a lot harder to reverse. Really, it's not.
Yeah. No. So type 1's not able to be reversed. So type 1, just to refresh everyone on that, is type 1 is when the pancreas, which creates insulin, doesn't work anymore. So the body doesn't actually create insulin, which is needed to actually take the blood out of the sugar out of our blood.
Right, yes.
So that's why type 1 diabetics have to actually inject themselves with insulin, which would normally be made in the pancreas.
Yeah.
Type 2 diabetes is not related. The pancreas is still working properly. We're still making insulin. It's just that the blood levels in the sugar are still too high.
Yep.
Sugar levels in the blood are still too high.
Fantastic. So the answer to that is isochrome and OPC3, and also exercise and good, obviously nutrition and like the holistic approach to eating and stuff like that, which we recommend TLS weight management solution. All right, Grace Wong, can people take Cartier? I don't know, Cartier? C-A-R.
Cartier, that's aspirin.
Oh, aspirin, okay. Take isochrome. Can they take isochrome and take Cartier? Yeah. Okay.
Aspirin's a blood thinner.
Yeah.
Aspirin's a blood thinner. It's given to those who have had heart attacks or clots or danger of heart issues, etc. Definitely. Now, OPCs can also be taken. One thing that does have to be noted is OPCs, because it does have an action on the blood vessels, as I was explaining, it dilates the blood vessels and we get more blood flow. That will be working with the Cartier to allow more blood flow. So that has to be somewhat managed as well.
Right.
Yeah, because if you got a medication that thins the blood, that's going to increase blood flow. Then all of a sudden you're taking something which dilates the blood vessels. Then now you've got extra blood flow. It needs to be managed.
Is that only OPC3 or isochrome as well?
No, OPC3.
Okay, yeah, but isochrome
Isochrome
is okay with blood thinner, yeah?
Yeah,
They
that's
can
right.
come back. Okay.
Yeah, that's fine.
Hey, Ro, my guest is here. Welcome, Ro. It's lovely to have you. She asked, for the immune system, you suggested that we continue with the 5 dosages vitamin C and 2 dosages of OPC3 until your body gets saturated. That is, your stools get runny. So what happens after that? Does that mean if you're feeling better, you stop? If you don't, you consult your practitioner to see if there's another reason for being ill?
Yeah, if your body's saturated with vitamin C, you go to 1 dose a day from that point on.
Okay.
You drop it to 1 dose a day.
Yes.
And you shouldn't be, if it's an immune response for a bacteria, bug, or something like that, you shouldn't be feeling ill after that length of time, after saturating the body.
Yes.
There's something else going on that needs to be investigated if we're still feeling ill after that.
Oh, yes. So after that, then have to consult practitioner, like you said there. But obviously, even after that, you don't really stop as such. You still have to have the preventative dose, right, with vitamin C and OPC. You don't stop them for good.
Yeah, that's right.
Yeah, which is like...
Because there's a bit of I'm a bit... So with that one, it's sort of like, so to be saturated is going to take... Generally, it's going to take anywhere from 5 days to 20 days.
Yep.
So generally, feeling better from a cold or a flu will take anywhere from 3 days to 10 days, depending on how good someone fights, or what the problem is, as in like a bug.
Yes.
So they generally don't overlap.
No.
So the problem is that the person feels better, and they generally ask, well, do I need to still be taking it? And the answer is yes, keep taking it even after you feel better until the body is full of vitamin C, it doesn't need any more, and it starts getting rid of it.
Yes, fantastic.
So I hope that answers that a little bit.
Yeah, so I guess like vitamin C is not absolutely necessary to take it every single day when you're well, but the daily essential would be good to take as like a health maintenance, as like a preventative measure.
Yeah, well, the multivitamin has vitamin C in it.
Yes.
It's got 200 I think it's 184. So close to 200, and the 1 dose of the vitamin C powder itself is 500 milligrams.
Yeah.
So it's about two-thirds of a dose. I take a dose of vitamin C every day.
Me too. I take daily essential vitamin C and isochrome too, so it's like
so important.
7 dose. But the thing is, like, depending on individuals, I would say vitamin C is still good to take as a preventative measure with your daily essential, because that way then your immunization is intact all the time, and you don't really get sick as easily as normal.
Yeah, and sinuses.
Oh yeah.
Part of the immune system. So allergies are part of the immune system response as well.
Yes.
General inflammation in the body is part of an immune response as well, often too. Even when we stem into arthritic problems,
yep,
a lot of those are rooted in immune system problems.
Right.
So very, very important.
Yep. Okay, and Colin, what about diabetes treatment for people taking warfarin? Have been told they cannot take isochrome.
Isochrome. I'm not sure about that one. I'll have to look into that one, Colin. I haven't heard that. Is it isochrome? Is it isochrome as in the chromium, or the coenzyme Q10, which is the activator of that?
What does it say on the bottle, Colin? Can you type it out? I have no idea. Because I know for sure that with OPC3, if someone is taking warfarin, then definitely would need to be checking with your doctor. But in terms of isochrome, is that will that be interfered with warfarin as well?
For myself, I'm not 100% sure. I have to look at the mechanisms why it actually works that way. So what mechanism chromium or coenzyme Q10 are activated with warfarin?
Yep, okay, sure. And Lei Hun asked a question in the WhatsApp group, is there any treatment for knee pain?
Sorry, what was that? Is there any treatment for knee pain?
That's right, knee pain, yes.
Yeah, the question is why is the knee pain there? Funny question, but is it just one knee or is it both knees? If it's both knees, that would be systemic, so it would be something through the system is creating that. If it is one knee, then it is actually due to injury that has been that is on the body? So is it an injury that happened quickly, or is it a chronic injury, like a wearing type of injury? So have we got that? Have we got?
So Lei Hun, can you type it here, either here or WhatsApp group? Is that one knee or two knee, and why is it both? She said both. So both knees are in pain. What would be the active treatment for that?
For both knees?
Yeah, for both knees, yes.
Both knees need to be looking systemically now. So what is it systemically in the blood system, etc.? What inflammation is elsewhere in the body? Yeah, so that needs to be looked at. Where is it? So is there inflammation in the liver, gallbladder? Because often what happens is we can have inflammation sitting under the surface in the body. So it's there, it's underneath the surface. We don't have symptoms, we don't see it very well. We can sometimes see it through the digestive system, not quite working well, and a few allergies here and there. But and then when we actually do a bit of damage to a joint or something, the inflammation really goes to that joint to try and heal it, and it's over. It's too much.
And she's had this pain for a few years. And what would be a good active treatment, like in that case?
Active treatment definitely for inflammation is going to be OPCs.
Yeah.
Yeah, definitely OPCs. I would recommend vitamin C's, OPCs.
Yeah, great. Okay, fantastic. And okay, so Colin here says that on the bottle of isochrome, do not take if under therapy without medical advice. However, I know that there were people, like some people even having isochrome. I mean, it's under medical advice. So maybe if the doctor allows, that should be okay. Yeah. And so Cecilia says, for allergy or runny nose, besides OPC3 and vitamin C, what other isotonic supplements are helpful?
There aren't any other than going to a healthy regime.
Yeah.
Of supplementation, and then going back to the foundations. So allergies are always a dysfunction of generally a dysfunction of the gut. So that has to be normalized.
Yes.
So allergies, I always find that OPCs and vitamin C are very, very good for when they're happening, and they decrease the symptoms and even get rid of them in some cases, etc. But underlying that, there's always more going on in the gut that is creating that allergy reaction to start with.
Yeah, so gut health is always related to a lot of other issues. So I guess the preventative regimen for gut health is also helpful, yeah, in conjunction with OPC and vitamin C.
Correct.
Yep. Does that make sense, Cecilia? Okay, I think that's about all the questions.
Cool, great. Yeah, great questions.
Yeah, they are, aren't they? Yep.
Yeah,
and great answers, Dr. Mark. Thank you so much. Very, very helpful. I've learned a lot. Even though I tend to have studied quite a lot about this health and nutrition division and line of our business throughout the last few years, and like what you've shared tonight has certainly increased more of my product knowledge. And that's why, it's so important for us to be able to support one another and keep learning, because you never learn enough.
That's right. There's always more to learn, isn't there?
Exactly, and there's always more and more technology, new research, and new things that we can. That's why it's so important for us to have training and Zoom meeting like this. So thank you everyone for coming on, and thanks once again, Dr. Mark, for your amazing presentation and sharing. And I am going to be doing next Wednesday another presentation, next Thursday, about how to transform your body and mind through the TLS system. So if you guys are interested, I will post the Zoom link for you all to attend if you like.